The Government Accountability Office, the GAO, has released a report that's been described, I think rightfully so, as scathing in relation to the country's ability to weather things like pandemics, weather disasters, and bioterrorism attacks. And I'm glad that they have this report because the last couple of years, there hasn't really been anything to let us know that our country is not prepared to weather these things. Dun-dun-dun. Anyway, they say that they're designating Health and Human Services leadership and coordination of public health emergencies as a high-risk area for the government. That is terrifying, by the way. We're covering this, and I'm glad that we are, but how is this not a bigger topic? These are huge calamities that could potentially hit us. And things like pandemics, sure, they only happen constantly, but weather disasters are multiple times a year, and we're simply not prepared. Let's give you some more details. They say longstanding persistent deficiencies at HHS, quote, have hindered the nation's response to the current COVID-19 pandemic and a variety of past threats. If left unaddressed, these deficiencies will continue to hamper the nation's ability to be prepared for and effectively respond to future threats. And they gave ideas of what some of these shortfalls might include, things like managing the medical supply chain, coordinating with federal and state agencies, and providing clear and consistent communication to the public and the healthcare community. And I think the panel can probably agree that all of these have been very clear and constant issues, even during the pandemic that we're still weathering. But Anna, what are your thoughts about this report?
My thoughts are it is fine and dandy that the GAO has put out this report. The question is what will be done about it? And hate to be a downer, but if we need to rely on Congress to allocate the necessary resources for this, nothing will be done. So we will be just as ill prepared for weather emergencies, we'll be just as ill prepared for any type of public health issue or emergency. So it's just, that's the reality that we're dealing with right now. And so we have to think about what we can do as ordinary people to apply pressure to Congress to get them to listen to us, right? That's really what we need to focus on, in addition to being strategic electorally and all of that. Because if we just have these reports and we just assume that something will be done about it, we will be disappointed and we will continue running into these issues.
Yeah, and Anna, you always say the fish rots from the head down, and it's so true in this case with COVID. I mean, what an exposure of the failures of American healthcare and supposedly the best healthcare in the world, right? And American information and all kinds of things, just any kind of coordination. This is what happens when you allow basically libertarian psychos who only care about their own pocketbooks to run government for 40 years. Like, oopsies, then there's a pandemic. Ooh, there's a natural disaster. We might need a government. Hey, that's cool. And sadly, as someone who grew up becoming politicized, so critical of the electoral system, so done with the two parties. And just when you want to throw it all out, as Anna says, we gotta put the pressure on because we don't have a choice. Everyone says, whether it's climate stuff or whether it's the pandemic, you're not gonna mobilize the amount of money and personnel that is needed to attack these things, to address these things without the federal government on board. It's just not gonna happen without that money. But I'm glad there's some sort of oversight, at least a little bit of a post-mortem check-in, what did we do wrong? It's still going. But it is scary to me, like HHS, the fact that like CDC and HHS are so separate, and it seems like HHS has been kind of hamstrung and sidelined, and like that's where the public health part is. CDC is where the emergency response and what do we do? How is the CDC's been screwing up for a long time. Let's be real. They're trying, but they can't do enough because truly this is going to be endemic. We need to make this a public health priority. We need Medicare for all, but we need to address this as a public health crisis, and HHS needs to be involved.
Yeah, totally. And look, we're, I think, understandably focusing mainly on the pandemic that we're already in. But let's bear in mind, we've had scares in the past decade with bird flu and swine flu and those sorts of things. Just because we have COVID, all over America and all throughout the world doesn't mean that other viruses are any less likely to go wild. So bear that in mind, as well as the issues that we have with natural disasters being exacerbated by climate change and those sorts of things. And my issue is that we cannot afford to be behind, have these sorts of shortfalls that they've identified in literally any way, because we know that no matter how prepared HHS or DHS or FEMA or whatever are, they're going to be weighed down by a now established and indisputable lack of willingness to participate on much of the American public's part with these sorts of things. So, like for instance, leading senators on both parties, it says, released draft legislation this week calling for a close study of the pandemic and an overhaul of HHS capabilities. So they want to see what we did wrong and fix it. Okay, cross your fingers that something like that, if they identified a solution, could even pass, because we're looking at this as, oh my God, HHS and CDC, they might not be prepared. There's like 50 million people that don't want them to be prepared for literally anything. They think that they're staffed entirely by Satanists. So like, we need to bear that in mind. There cannot be a gap in the capabilities of these organizations, because we know that we're already gonna run up against so many issues with getting people to comply, even with accurate, well-transmitted, easy to follow information. The supply chain needs to be there, because we're already gonna have enough trouble getting people to actually use the things if they're made available.
Yeah. In fact, just to lend some meat to your argument, which is a good one. In the same one of the articles talking about this GAO report, they comment, or they use a quote coming from Republican Senator Richard Burr. And he just used it as an opportunity to say negative things about our institutions, because he's a Republican lawmaker, doesn't believe in them. So he was talking about how the CDC is a mess and they're putting out conflicting information and confusing people. But John, if I remember correctly, wasn't Richard Burr one of those senators who was part of that closed door coronavirus briefing in the very beginning of the pandemic, who then later on went and traded stocks that would be negatively impacted by the pandemic, and then bought stocks that would be helped by the pandemic? And then he went and told Americans that there was nothing to worry about.
Yeah.
So like, for him to be used as a quote in any news article regarding confusing people or spreading misinformation it's just rich. It really is.
Yeah.
No, and that's, I mean, this is the other thing about Biden's handling of the pandemic that really bothers me, to be honest, is again, the cavalierness with which he has said that he can stop the virus. Well, he can't. Nobody can. It is unprecedented was the word on everyone's lips 2 years ago for a reason. This thing mutates, it changes. So what can we do to mitigate the damage? Of course, the vaccine is part of that. Of course, that rollout is part of that, but so is hazard pay. So is the ability to heal and stay home. And I know we're gonna talk about that a little bit later. So I just wish there was more humility from the federal government and more of a like, all right, we can't just like Bruce Willis our way through this. And whereas the ones were like, we're gonna Donald Trump our way through it, which is like, the pandemic called me fat, how dare you, whatever it was, like, like I'm personally offended, you're just a 6. And so like, but then the alternative of like Biden's like, well, I'm gonna tough it out. It's like, no. Everyone needs to bow down and we need to solve this, and not on a patchwork level. My God, have you felt any more atomized as a country than watching every state do something a little bit different for a period of 3 weeks until we change strategies?
Yeah.
Terrifying.
Thanks for watching The Young Turks, really appreciate it. Another way to show support is through YouTube memberships. You'll get to interact with us more. There's live chat emojis, badges. You've got emojis of me, Anna, John, JR. So those are super fun. But you also get playback of our exclusive member-only shows and specials right after they air. So all of that, all you gotta do is click that join button right underneath the video. Thank you.